I established this practice starting with a small office, but then we expanded. I brought in state-of-the-art facility to serve the patients around here. We have top-of-the-line equipment of treatment and chemotherapy delivery. Chemotherapy is a very delicate business. We have to keep the temperature of different chemotherapy drugs at different levels, and that basically keeps the drug in perfect shape. We have to have chemotherapy nurses who are chemotherapy certified and trained properly in giving chemotherapy. So I have chemotherapy certified nurses who are providing this treatment to all these patients. Our facility is equipped with the best possible equipment.
Don't settle for anything less than the very best when it comes to your health. The Cancer Center, here in Lawrence County, is Dublin Hematology and Oncology Care.
Hello everyone, we're at the beautiful Dublin Country Club, and we've got some amazing doctors that are gracing us with their presence here in the Dublin-Lawrence County area. And we've got a wonderful doctor here from Charleston, South Carolina. We're going to let him introduce himself to you all and just tell you just a little bit about himself. How are you, doctor?
Hey, I'm doing great.
All right, well listen, talk to us a little bit about you. We're going to keep it short and sweet, Doc, but we want them just to see your face and just to know that you're here in the community, and we definitely want you to know that you're welcome.
Sure, yeah, my name is Craig Rosebrock. I'm a pulmonary critical care physician from Charleston, South Carolina. I went to med school and residency with Dr. Agarwal. I'll be joining him with his practice here in Dublin, Georgia.
Now, how long have you been in practice yourself?
I've been in practice for about 8 years.
About 8 years, wonderful. Now, so you have not been here in Dublin that long, have you?
No, less than a week.
Less than a week. Now, are you feeling a little bit kind of getting that hometown welcome a little bit?
Yeah, absolutely. It's been a great place to be so far. People are very friendly.
All right, and so you're going to be tag teaming with Dr. Agarwal.
That's right.
And so and you've already worked with him before.
Right, yeah, we went to med school and residency, so we've worked a good
Oh,
bit.
wow. So,
yeah.
you know, bringing you in, I'm sure he's definitely excited to have you into the fold.
Yep, absolutely. It's been
All
great.
right. Well, listen, I know that Charleston is a little bit different. So how's Charleston been now? Because we've got friends there, and Charleston is such a beautiful, beautiful historical place. And then coming to Dublin.
Oh,
Has that been a huge transition?
It's a great place to be. It's South Carolina and Georgia are very similar in terms of their climate, so I've felt kind of quite at home.
And, you know, and we're always so excited when Ferry Park Hospital lets us know that there's some exciting doctors that are coming in with such great expertise. And so we are definitely, for whatever time that you're here, doctor, we're so glad to have you here.
Thanks a lot.
All right, ladies and gentlemen, this is Dr. Craig Rosebrock. You know, ladies and gentlemen, we've just been having a wonderful time meeting the doctors here, and we've got an amazing doctor here. And I tell you, he's been such a treat off camera. We want you to have the opportunity to meet him yourself. Doc, you've got to tell them a little bit about you.
Well, my name is Ed Hayes. I was born and raised in Spartanburg, South Carolina, little crossroads in Spartanburg. Went to Clemson, for all you Georgia fans. I know you love me.
They're throwing tomatoes at the screen
That's
now.
right,
You know
right
that, right?
now. Right now. Oof.
Oh, I think I felt that
Jim
too.
just threw one.
I think he did. I think he did.
Went to medical school at the Medical University of South Carolina and trained at University of Texas and MD Anderson Hospital Systems in Houston. Spent 4 years in the Air Force and then came back to Myrtle Beach, Conway area in South Carolina and practiced there for almost 25 years before coming to the great state of Georgia.
Oh, wow. And you've been here since when, Dr. Hayes?
Since January.
Well, we're certainly glad to have you here.
Well, thank you. It's
Now,
nice to be here.
So you are now a transplanted Georgian. You know that.
I have Georgia roots, though. My uncle was a bulldog,
Oh, wow.
and my daughter, who was an Auburn Tiger, married a Georgia bulldog. Nice. And they live down in St. Simons now. So, you know, hopefully I'll have little
Just a little bit.
grandchildren running around the beach
Oh,
down
my,
there.
that would be nice,
For
wouldn't
too
it?
much longer. It would be very nice.
All right. Now, listen, talk to us about your specialty, please.
I am a urologist. And for any of you that don't know what a urologist is, we take care of the urinary tract, which is from the kidneys all the way down to where you pass your urine from. And take care of multiple problems from kidney stones, infections, prostate problems, prostate cancer,
Right.
and other things that we'll talk about in private.
That's right. That's right. And I want to ask you this because you're especially, of course, with prostate cancer. I've had so many males in my family that have had prostate cancer.
Yes.
And, so could you give us a little information about that as far as like early prevention or just kind of some things that people should look out for? Or is there any kind of telltale signs?
The main symptom of prostate cancer is really no symptoms at all.
Oh, wow.
Asymptomatic. And people need to have their prostate examined routinely, and what our official recommendations are to start at age 45 to 50 with an annual exam, a digital exam, and a PSA, which is a simple blood test, except in those people that are high risk. And high risk are African Americans are at high risk for prostate cancer, as are people whose fathers have had prostate cancer, or it's on their father's side. In other words, an uncle, a grandfather, that kind of stuff. But the main key is that it's the father's side that really dictates your increased risk.
And and we talk a lot about hereditary things. And do you see that as a physician that plays a huge part in ailments that we may incur?
Oh, by all means.
Yeah.
By all means, especially prostate cancer. If you look at the data, if your father has had prostate cancer, your risks are much greater in developing the tumor than if your father is not a carrier of that gene.
Wow. And so tell us about your practice here in Dublin.
I basically do just general urology. We have excellent referral basis to send anything that's real complicated, but what I do is take care of just the myriad of the common complaints that people have, and with the numbers of people here, we do see some interesting things that go either to Augusta or Atlanta or some Jamaican, but most of the things we can handle here.
And that's great. And I think people need to know that we've got some great physicians here in the Dublin-Lawrence County area. And of course, if you see fit for them to get further treatment, there's no issue with actually transferring or referring them to some other physician. Is that correct?
Oh, none whatsoever.
Yeah.
I mean, I've always believed that somebody that's doing a complicated procedure once or twice a week is going to be much better at doing it than anyone that does it once or twice a year.
Right.
So it makes perfect sense to me, and that's the way I've always been.
Absolutely. Now, Dr. Hayes, I want to lighten up a little bit, and you seem to be like a gentleman that really that likes to have fun, because in the midst of your profession, there's still a personal side of you that, just from off camera, you're a hoot.
I resemble that remark.
You are a hoot. You are. And so what do you do to relax, Dr. Hayes?
Well, I read and I work, and I have a certain love for Judge Judy.
Now, did you secretly want to be a judge in another life?
No.
You just love... Oh, you...
I'm judgmental enough as it is.
I love it. Dr. Hayes, I love it. And and with what I like to do is when I relax, I love to be on stage. And you and I were talking. I think that there should be an opportunity here where you and I could do some stage work.
Okay. That's fine with me. I mean, I'm up for it.
You're up for it?
Yeah.
You just have to find time in your busy schedule.
No, I'll make it. It will happen.
We'll make it happen.
Oh, yeah.
You've heard it, ladies and gentlemen. Dr. Ed Hayes and Pat Terrio are going to be hitting the stage. We're going to do some improv, right?
Look out, Broadway.
I love it. We just better not wind up on Judge Judy, though, right?
Oh, well, she might come and visit. She could be our straight person.
She really could. She really could. Well, Dr. Hayes, it's been such a pleasure to meet you.
Pleasure.
We're so glad to have you here in our community and providing such a great service to the people, to the men and women here of Lawrence County. Thank you so much.
Can I say one thing?
You sure can.
the people in Lawrence County should realize what a great medical center they have here. The medical staff and the facilities are really second to none.
Yeah.
So I encourage you to stay local and support this facility and the assets in it, and knowing that it is such an asset to this town and to this area.
Thank you. I concur that.
They'll pay me for that.
They heard you. Ladies and gentlemen, this is Dr. Ed. Dr. Ed Hayes. Welcome.
Oh, thank you.
Love it.
In this moment, it doesn't matter if you save money in 15 minutes. It doesn't matter if your neighbor has the same insurance that you do. What matters right now is the quality of your independent insurance agent
Glad you're okay, Sarah. We'll take care of everything.
and the company that stands behind them.
Thanks so much for your help.
No problem.
Auto Owners Insurance.
Or Insurance Group in Dublin is your local independent auto owners insurance agency.
All right, ladies and gentlemen, we've got another doctor here that is here with us in the Dublin, Lawrence County area. Dr. Cunningham, how are you?
I'm fine. Good evening.
Nice to see you, doctor.
Yeah, nice to see you.
All right, now listen, we want you to start off kind of giving us a little tidbits about yourself and your family, if you would.
Sure. I have a wife, Becky, and I have 3 boys, one who's 14, Travis, and then 2 younger boys, 4 and 2, Kian and Liam, and they're a handful.
I was going to say that because that's such an age gap.
It is an age gap, so, but we love it. They're the 2 little ones are full contact, and
Yes.
having the older one was nice too. He's past that, so no, it's great.
Yeah.
I love it.
All right, now tell us where you based out of. And of course, you know, ladies and gentlemen, you might not be able to tell it, but this guy is a former player, football player. You might not be able to tell it.
Yeah, once upon a time
Yeah.
I was. I played football at Auburn. I was there in 1989 through 92. I was Coach Dye's last couple of years at
Nice.
Auburn, and it was a fantastic experience.
And of course, you felt, you know, you followed in your dad's footstep, at least to a certain extent, right?
I did. My dad played at Arkansas on the national championship team, 1964, and then played the NFL for 8 years. So
How cool was that?
yeah, we have some football blood in the family, so
Yeah.
that's kind of cool.
Now, were you one of those kids that followed your dad around all the time?
We were pretty close. The
Yeah.
whole family was. I mean, what's funny, we lived in the same bedroom, bathroom, and family room. Those were the 3 rooms we were in all the time
Right,
together
right.
with my sister and mom and dad. So we were pretty close.
And so you come from, you're from Pennsylvania.
I was just in Pennsylvania 5 years after my fellowship at Emory.
Mm-hmm.
I was there 5 years practicing in an interventional radiology group.
All right. Now let's talk about your practice and the work that you do here, your
sure.
specialty.
I'm an interventional radiologist, and so I'm a proceduralist. My training's in radiology, and we do procedures using image guidance, and very similar to operating like a surgeon, but we use the imaging to assist us with guiding needles and catheters where we want them to go.
So can you explain that a little bit as far as the type procedure that you would do for a particular?
Sure,
Yeah.
sure. Most people may have some familiarity with cardiac catheterization, where
Yes.
patients will come in and you go through the groin with catheters and then look at the heart. That all has grown out of the field of radiology, using imaging to get in vessels with catheters and outside of the heart, where the doctors will deal with most of the other organs in the body, putting catheters there or putting drains in those places, again, using image guidance.
And how advanced has that become? Because I can remember probably, it was like in 1988. I remember like when I had an MRI. That was
Yes.
such a big thing.
Yes.
I remember having to go to Atlanta because they didn't have the facilities, you know, where I was at the time. And so
Right.
that was such a big thing.
Well, the thing that I really like about radiology is that it's a technology-driven field.
Right,
so
right.
It continues to grow, and with technology, as that improves, the imaging improves. The ability to do things that are invasive but
Right.
less invasive or minimally invasive is very important in terms of getting patients in and out of the hospital.
Recovery time.
Improving their recovery time, and that's very impactful and meaningful to patients, and I think that's a real plus. The other thing that's nice too as an interventional radiologist is we play a support role for the other doctors who doctor you just met, Dr. Hayes, are all
Right.
a number of doctors that do procedures that sometimes we will step in and assist with things afterwards that they may need help with, and so that's another aspect I enjoy, is working with those colleagues to take care of people. So.
And being on the other side of that, I guess being a patient and seeing that there's so many different changes that have happened and occurred in the medical field,
Yeah.
and now you're talking about the use of technology, how it's so prominent in the healing process and different things. So, and I think that that's good. That's a very good thing.
Yeah,
And we
it
want people
is.
to know that that's here in Dublin.
It is here in Dublin.
Yeah.
The colleagues that I have in radiology have already been offering some of those services. We'll be expanding those now, and they've done some great legwork on the front end before I've arrived here, and we'll continue to build on that and
Right.
increase the number of services we provide.
And tell us, where's your practice? Where are you located?
Fairview Park Hospital.
At Fairview Park, and we featured Fairview Park when we did that. We were in the cath lab.
Oh, okay.
I was lying on the table, Doc.
Oh, fantastic.
Yeah, it wasn't pleasant. I'm just telling you. Like, people were calling in, checking on me to make sure I was okay,
It's
because I was crying.
it's an experience to be in a room and to see all that equipment. It's a little intimidating sometimes.
It really is. And I think that, when we were speaking about this particular thing, that when a person is in distress and when they are in that position, your job and your ability to keep calm,
I think
helps.
No, that's critical. I was talking to one of our managers in interventional radiology today at the hospital,
Yeah.
and I think that's crucial. I mean, I think the best quality a doctor can have is that when the things are not going the way you want them to go,
Right.
they're very cool, collected, and are not easily
Shaken.
And that's a real important quality.
You're like a rock of Gibraltar, right?
It's important.
Yeah, it is. And so how long have you been in Dublin?
I've been here 2.5 weeks, so my family, I moved them here over a month ago, but
Yeah.
I just finished up there and come down.
And so how's your transition been? We know it's a little different from where you came
The
from.
community's been fantastic. I grew up in Fayetteville, Georgia, so
Oh, yeah.
being back home has been wonderful, and the community outreach has been phenomenal.
Well, we're certainly glad that you are here, and we're glad that you brought your family down.
Thank you.
Now, is there any chance that you may have any of this Georgia Bulldog stuff rub off on you a tad?
We do own a bulldog. We own an English
Yeah.
bulldog. So. And the first dog I ever owned was a bulldog, and her name was Herschel, after Herschel Walker.
Fate.
That-
Fate
I'm
has
telling
brought
you,
you here.
yep, that's
Fate has
right,
brought
that's
you here.
right.
Well, it's certainly a pleasure meeting you, Dr.
Yeah,
Cunningham.
thank you very much.
All right, welcome to the community.
Yep, thank you.
All right, ladies and gentlemen, we've been welcoming doctors, but we also have one that's been a little bit of a farewell. He's retiring. We're going to talk to him just a little bit, Dr. Charles Young. This is kind of bittersweet, Dr. Young, for some of us.
Yeah, most of the medical staff have told me I can't retire, but it's time.
And we want.
I just turned 64, and
That's
my
awesome.
daughter's away at college,
Yeah.
and so it's time to spend more time at home. So
Absolutely. And, and they told us to make sure we let everyone know how many doctors depended on you and your expertise. And so you're definitely going to be missed. Now, they say that you're going to come back just a little bit, or?
yeah, casual part-time to fill in for vacations as
Okay.
needed. So
All right. So let's talk about how has your journey been, Dr. Young? Tell us about your journey. Like, when did it start and where did it start?
well, I actually started in practice in Detroit, Michigan. In Detroit, Michigan, following my residency at Wayne State University. I then moved to Pennsylvania, where I was there for probably 15 years in two different practices.
Right.
And then 10 and a half years ago, we moved down to South Carolina. And was in various hospitals for several years. And then 6 years ago, I got a position here.
Yeah.
And have been here since. And it's been a good practice, and met a lot of nice people, and hopefully I've been able to help out a lot. So.
Absolutely. You saved a lot of lives, doctor, if you could calculate that. So how many years of practice have you had?
32.
32 years.
32 years in practice.
And and you've worked in that particular field the entire time.
Yep.
What have been the changes? I'm sure in those 32 years, you've seen a lot of different changes with the technology of things and how things were done.
Oh, absolutely, especially in the area of interventional radiology with all the technological advances. Also, during my residency, we did not learn MRI because it wasn't a modality then.
Right.
It was just in its infancy.
I was-
Really,
I know, because I was telling Dr. Cunningham that when I had torn my cartilage and ligaments in my knee, that was back in 1988, and they came up, they said, well, you need to have an MRI. I didn't even know what that was.
Right.
So they had to send me up to the big city of Atlanta.
It didn't come out till like the mid-'80s.
Yeah.
Right?
And
So-
I knew that it was new, but they didn't have it where we were. And so we had to go to the, the big city, and they had, I remember all of the instructions they were giving me, to be prepared for this thing. But so much has changed.
Yeah, it really has.
So much has changed. And in positive advancement.
Yes, very positive.
And so your life has been a certain way for so many years, doctor. So now what's next for you? I mean, because there's going to be a total transition for you.
Well, it's just going to be more of stuff that I've done in the past and want to do more of.
Right.
I'm an avid golfer.
You are.
Yeah,
Now, are you a good golfer?
Yeah.
Have you been out with Dr. Nelson yet? Dr.
No.
Nelson Carson? That's going to be your ultimate, to go out with the golf daddy himself.
Yep, I hear that. No, I have not golfed with him. We live in a golfing community. In fact, I live on the 11th fairway, so
Oh, nice.
so I can play golf every day if I want. In the past, I was an avid fisherman, but I didn't have time to do both. And now I can.
Now you can
and
do
I
both.
I can, share the time between the two things I love. So.
And then if you have any honeydew lists that you need to do around the house,
Yep.
right?
There's that because, Monday through Friday I'm out of town.
Oh, wow.
So I'm only home on the weekend, so,
Wow.
yeah, so
And you know
that'll
that-
be a change, especially for my wife.
She's going to ask you, so do you have anything you need to be doing right now?
Yeah, that'll be part of it.
But you know what? Throughout the span of your 32 years, you have impacted so many lives, and you've changed lives, and you've saved lives. Is there any particular case that you can remember that has been most memorable for you throughout your career?
Actually, yes, when I was in practice in Meadville, Pennsylvania, there was a retired volunteer in the hospital that came in with basically a dead arm. He'd thrown an embolus from his heart to the artery to his arm. And when I got in, basically, clinically, his hand was dead. He had no movement, no feeling.
Right.
I was able to open the artery up with thrombolytic therapy and saved his arm.
Wow.
That's probably the most memorable.
That's amazing.
Yeah.
That's amazing. So you've saved lives, you've changed lives. And and those are things that that helps and keeps doctors keep doing what they do. And you've done it for 32 years, and we're certainly appreciative of the work that you've done, and still managing to come back every now and again to fill in,
Yep,
right?
that's right.
So we're, you're not getting rid of us completely.
Yep.
All right. Well, listen, Dr. Young, thank you so much for your many years of service and to continue to serve us.
Oh, it's been my pleasure.
All right. Ladies and gentlemen, this is Dr. Charles Young. Thank you.
Riverview Golf Course, located on the beautiful Oconee River, is open to the public 7 days a week from 7 till 7, and you can play all day for just $25. Riverview Golf Course opened in the spring of 1977 and has been enjoyed by thousands since. Come on out to Riverview Golf Course today off Highway 19 at Riverview Drive, just 2 miles off I-16, exit 54. Riverview Golf Course in Dublin, making memories every day.
All right, ladies and gentlemen, it is so exciting to meet two beautiful ladies here with Dublin Eye Associates. We're going to let them introduce themselves to you, and we're going to have just a little girl talk. We'll start with you, young lady. How are you?
I'm good. I am. My name is Felicia Fountain. I'm from Mount Vernon, Georgia.
Nice to meet you, Felicia. Now tell us a little bit about yourself, if you would.
Okay. I grew up in Mount Vernon, Georgia, which is pretty close to Dublin. I went to undergraduate at the University of Georgia, where I got a biology degree. I then went to the Medical College of Georgia. That's where I obtained my medical degree. And from there, I've been at Emory, where I did my ophthalmology residency, after which I stayed on and did a glaucoma fellowship for a year.
Oh, very good. Fantastic. Well, we're certainly glad to have you here.
Thank you.
And also, you have a little one.
I do. I have. I shouldn't forget him. That's my prized possession. I have an 8-year-old son named Aiden.
Aiden, how cool is that? Well,
Yep.
well, welcome. Glad to have you here. All right, and now your turn, please.
Sure. I'm Katie Johnson. I am a resident of Dublin, born and raised, and it's great to be back. I moved back to Dublin in 2011. I've really enjoyed the blessing of trying to give back to the community that gave me so much growing up, and I went to Dublin High School, and then from there I went to Presbyterian College, which is a liberal arts school in South Carolina.
Yes,
Go Blue
very,
Hose.
very familiar, yes.
So, and then I did my optometry training at Southern College of Optometry in Memphis, Tennessee, and then I did my residency at Bascom Palmer Eye Institute, which is in Miami, Florida.
Oh, nice.
And then I moved back to Dublin Eye Associates,
All right,
and was
very
very
good.
grateful to do so.
Glad to have you back, and you're also a newlywed.
I am. I got married in May, and it's been the best
All
best
right.
summer of my life.
Very good. Well, congratulations to you.
Thank you.
All right, now, Dr. Falter, we want you to talk to us a little bit about what your profession is. You know, it kind of speak in layman term a little bit to kind of differentiate between what both of you do. Is that okay?
Yeah, sure.
All right.
Okay. Well, I'm an ophthalmologist, so I treat all diseases of the eye from the very front, which is called the anterior segment, to the very back of the eye, which is called the posterior segment. I specialize in glaucoma. Glaucoma is a disease that most people, some people confuse with cataract. Cataract is
Right.
the natural aging of the lens of the eye. Glaucoma is actually a disease of the optic nerve, which is optic nerve damage. The
Right.
optic nerve connects the eyeball to the brain. In glaucoma, it can be actual devastating disease if it's not diagnosed and treated appropriately ahead of time.
Right.
Because the damage that we do to the optic nerve is irreversible. It's a disease that takes away your peripheral vision, so you often don't know that you have it until it's very advanced. And like I said, it's irreversible once it's there. So I treat that disease with lasers, medical treatment, and also surgery if needed.
And is that anything that's hereditary? Because I know my father had issues of such.
There is a hereditary component, but you do not have to have a family history to have glaucoma. So just because you don't have a family history, you are not immune to getting the disease.
Okay. All right. Very good. Thank you so much.
Sure.
All right. Your turn, Dr. Johnson.
Sure. I'm still getting used to hearing Dr. Johnson.
I know, but it has a nice ring to it, doesn't it?
So I am a primary eye care provider. You can kind of think of me as your primary care doctor, as you would your primary care medical doctor.
Right.
So sort of the gateway. I can refer you to any appropriate specialist when needed. I do treat all types of eye disease before it needs surgery. So
Right.
I do all kinds of therapy and monitoring for disease, including patients with diabetes, cataract, glaucoma before it needs surgery. Dry eye syndrome is a big part of my practice, and also medically necessary contact lenses. But I guess if I was speaking to a large group like this, I would remember the most important thing is if you're diabetic, do get your yearly eye exam, because it is the #1 cause of blindness in Middle Georgia. And a lot of times all it takes is that once-a-year screening process. Do it for yourself so that you can continue to serve your friends and family.
And I'm so glad that you made that public service announcement, because it's so true. It is so true. And you know, and there's I know a lot of people who are diabetic who don't necessarily get the proper treatment that they need, or don't necessarily, you know, adhere to the diets that they have to adhere to.
It's a lot to learn when you get that diagnosis and you're trying to absorb everything that's
Process it.
included with that. There's a lot of doctors that you have to visit, a lot of new assignments that you're instructed to adhere to. And so if the one message I could get across, if you know someone, a loved one or a friend with diabetes, just encourage them, have you gotten your eyes checked this year? Because it's so important and such a great way to prevent blindness.
Absolutely. And as I'm talking to you both, I'm thinking it's time for my eye exam. You know,
I'm a walking public
I
service
am
announcement.
you definitely are. Well, because let me say this. I'm the 13th of 14 children.
Wow.
And so well, that was not my initial thing, Dr. Fountain. That wasn't the excitement there.
We want your family's business.
Yes, but I want to say this. This is what I would say, because out of all 14 kids, it's like we all either wear glasses or contacts, or, you know, with my brothers, I got to say this, colorblind, you know, and so with myself, I have an astigmatism in both eyes. And so I remember, as I've been wearing glasses since I was in the 7th grade. Now, would you say that that's hereditary? Who would be able to answer that when you see a family of all of them wearing glasses? And
Probably the better one.
Well, if you have two parents that are nearsighted, you have a 50% chance of being nearsighted yourself. So I would say, and this is a good opportunity to talk about, when does a child need an eye exam? You know, what is the appropriate time? You know, your pediatrician and your school nurse are going to do screenings. I would say if you do have a family history, having an exam before they start kindergarten would be a good idea, even if nothing's come up so far. If you don't have a family history, it's been shown scientifically that most of those screenings are going to do a good job. And there's not really enough resources in the public for every single child to have an eye exam, although that would be ideal if it were available. So at age 5, and then if they don't have any eye problems, maybe 3 to 4 years apart, do some other eye exams, because as you grow, you're needing new shoes, new pants, and your eyes are growing as well, so you may develop a nearsightedness or another refractive error in 3rd or 4th grade or so. So you want to space those screenings out.
And I'm glad you said that, because my son, who's 17, is legally blind, and so he's had different procedures, and I know that he will have to have surgery. You know, from what we were told, like in his 20s. And so that's been such a huge issue. His dad, of course, wore glasses and then had LASIK, and then mama here has been 4 eyes for a long time. You know what I mean? And so, and I'm glad that you did say that, because I think that kids do need to get their eyes examined early on. And do you work more with older patients, would you say?
I would say most of my practice at this point, which is pretty new because I've only been with the practice for 3 months.
That's right.
Most of my practice are adults, but I also do see kids, especially kids with glaucoma. I'm very comfortable treating pediatric glaucoma.
And you know, I've always been, like, growing up, always very careful and sensitive about not getting things in your eyes. And I remember, I want to ask you this, because there's some people that probably might think this. As a kid, I was told, do not sit so close to the television. Is that a fallacy, or is that
Sit
true?
wherever you want.
Oh my God!
That is one of the oldest wives' tales I've ever. You hear that all the time. My parents told me the same thing, and man, I was so glad that when I had finished my residency, I could tell my dad that is not true. You lied to me all those years.
I have been tricked my entire life. All the times I would sit so close to try to,
Exactly.
to try to see the little pegs and the thing. Thank you, family. Well, listen, ladies, we're so glad to have you all here, and glad to have you part of Dublin Eye Associates. You, Georgia girl, Dublin girl, so happy to have you here. Hope you enjoy married life.
Oh, I know I will.
Find some time to kind of, you know, relax.
We do.
All right, and we know that your young son keeps you busy.
He does.
All right, but we're glad that you're here, and we know you're going to get acclimated to your environment here. All right.
Yes.
And it's such a pleasure, and we hope to see you again soon.
Thank you.
The fabulous ladies of Dublin Eye Associates, Dr. Johnson and Dr. Fountain. Thank you, ladies.
Thank you.
All right, ladies and gentlemen, we've got another farewell this evening. We've got Dr. Monty Schumann. How are you, doctor?
Doing fine.
You know, you're going to be missed.
Thank you.
You're going to be missed at the medical
I'm
center.
not leaving town, so
I know,
I'll
but
be right here. So.
But you know, people are going to be coming into the medical center asking about you and asking for you, especially the ones that, you know, are just used to you.
Right.
All right. So give us a little history about how your journey has been in the medical practice.
Well, I've been here in Dublin 36 years ago. I practiced at the medical center for 35 years, and had just a good experience. Was very blessed, and Dublin's been very, very good to us. It's home, and it's just been a great place to practice, a great place to raise a family, and got a very good hospital, real strong hospital that's always done just a good job, and always been very helpful, and I've just been very blessed.
Amen. And tell us about your specialty, your expertise, your
family
area.
medicine, family practice,
medicine,
right.
And you know, and you have a family, of course.
That's correct.
You're an empty nester.
Yes, right. That's right.
So now, Dr. Schumann, now this will give you an opportunity to really, you know, we talked with Dr. Young.
Right.
And this will give you an opportunity now that you're retiring to kind of do those things that you've kind of put on the back burner, so to speak.
Yes. I'm staying busy and doing a lot of fun things, and enjoying retirement. And I do miss the patients, and I miss my partners and the folks at the hospital, and my employees. You know, had great employees and great partners, great hospital. I missed that part of it, but a lot of other things that I'm doing that enjoying.
That's good. So your transition has been pretty smooth.
Oh yeah.
All right. Now, and throughout your journey, has there been anything that's touched you the most? Because when you talk about what you do as a family practitioner, you get people that come in whatever condition, and there are usually some that have touched you in a mighty special way. Is there any case in particular that
Not any one particular.
Yeah.
Just a lot of wonderful people, a lot
Yeah.
of great patients, and not any one specific, I don't suppose. You know, a lot of happy things and some sad things, but
Yeah.
it's a lot of patience.
What motivated you? We always, you know, whatever we do, there has to be an inward to a motivation to just to push us to continue each day. And you have been in the medical field for a mighty long time.
35 years.
Yeah.
Just I don't. It's a big need, and
Yeah.
just was the work ethic, and you just feel like you need to go and do the best you can every day, and put what you got into what you're doing, and like I say, I've been very, very blessed.
Yeah, and you've definitely done that.
Absolutely. Yeah.
You are a staple in this community.
Well, thank you. Thank you. I appreciate that.
Definitely a staple in this community. And, you know, we're so privileged to be able to have had this opportunity to just speak with you just a few moments, you know, just for you to share with us about your experience and, of course, your exit, so to speak. You haven't left the community,
No,
but there has
no.
been a change, a shift. And so we're just pleased to have had the moment to speak with you, Dr. Schumann.
Thank you.
All right. We certainly wish you the best.
Thank you.
God bless you.
Thank you very
Dr.
much.
Monty Schumann, everyone.